The next question, the member for Ottawa South.
Thank you very much, Speaker. My question is to the Premier. We all know that since 2018, the gaps in our healthcare system have grown wider. 2.5 million Ontarians don't have a family doctor. 11,000 people died on a wait list for something last year. And now patients at home in palliative care at the end of their lives are not receiving the pain medication that they need. And people living at home with a chronic illness or frail seniors are not getting the basic medical supplies that they need. We all know that. We all have heard that in here. We've all read it. So yesterday the Premier said, I'm going to get to the bottom of this. So, Speaker, my question to the Premier is, will the Premier join our call to have the Auditor General look at the situation at Ontario Healthcare at Home?
To reply, Parliamentary Assistant for the Minister of Health and member for Essex.
We all know how important it is for people in Ontario to receive the medical supplies they need at home, including people who are receiving palliative care. Those medical supplies are absolutely essential, and it's utterly unacceptable that there be any interruption in the delivery of those supplies. The Minister has already contacted Ontario Health at Home and given the directive to make sure that they take any and all means necessary and required to deliver the medical supplies that have been requested. The supplies are there. They need to be delivered. In addition to that, the Minister has activated a call line where people can seek reimbursement for any costs that they've incurred seeking supplies by alternative means. And in addition to that, the Minister has already activated a special assistance team to make sure that the logistics system that delivers these supplies does so as required. All of those steps have already been taken, Mr. Speaker.
Supplementary question.
Member's right, it's utterly unacceptable, just like it's unacceptable that 13,000 people in his riding don't have a family doctor. Wow. Speaker, I know that the other party leaders on this side of the House will join us in this call. The Premier should as well. So, my sisters and I cared for both our mum and dad at home at the end of their lives. It was hard. It was difficult. So when I think about the suffering that's happening right now and what these families are going through, Speaker, it makes me angry. It makes me want to get to the bottom of this. It should make all of us angry and want to get to the bottom of this. So, if the Premier is truly a man of his word, and he wants to get to the bottom of this, then he will join us in asking the Auditor General to look at the situation at Ontario Health at Home. Will the Premier commit to do that today?
Mr. Speaker, it's very admirable that the member and his siblings have taken care of their parent, and that is a very good and proper thing to do. All of the people who are at home and require delivery of medical services at home, such as palliative care medical assistance, deserve to have that delivered at home and on time. The delivery service for that is called Ontario Health at Home, and the Minister has already communicated with Ontario Health at Home to make all and necessary means necessary to get those deliveries made. In addition to that, the Minister has already activated a call line for anybody who needs to be reimbursed for medical supplies that were ordered or ordered by an alternative means, and that has already been activated. Furthermore, there's also a special logistics team that has been set up to make sure that those supplies are made and delivered to where they're supposed to arrive at. Thank you, Mr. Speaker.